Today we will talk about a very good remedy that helps with problems with veins on the legs. Let's first figure out what the venous system is and how it differs from the arterial system. Veins are vessels through which blood returns from the legs and from the tips of the fingers back to the heart. This is deoxygenated blood. That is, there is no oxygen in it anymore. The unique feature of the vein system is that it does not have a pump. Blood moves only through muscle contraction and movement. Therefore, if you have a sedentary lifestyle or you stand a lot, then you may have more problems with your veins. We have many arteries that reach all the way to the feet and to the tips of the fingers. Then the blood flows through small capillaries and oxygen and nutrients are given to the tissues. After that, the blood returns to the heart through the veins. There is also a system of veins connected to the digestive organs. These veins transport nutrients from the digestive system back through the liver to the heart again. This is the so-called portal system of the liver. And if you have something in your liver that prevents this flow, such as scar tissue or cirrhosis, or if your liver is fatty, then you will have problems with your veins, such as venous blood stagnation due to insufficient pressure. In principle, the liver can be compared to a sponge. If this sponge is filled with something that prevents the flow of fluid through it, such as scar tissue or fat, then the sponge stops functioning. She can no longer hold liquids properly and work normally, and your fluid pressure in the system will definitely decrease if such a sponge is connected there. For example, if you have a water filter installed at home and it is clogged, this will lead to a drop in pressure. At the same time, the flow of water in one part of the house will weaken, and in the other, on the contrary, it will increase. And when the pressure in some part of the venous system is increased, it can lead to things like varicose veins. The veins may become enlarged, including in the esophagus. This is called varicose veins of the esophagus. And also in the lower part of the rectum. It's called hemorrhoids. The veins in the stomach may also be affected. This is varicose veins of the stomach. And one big cause of vein problems is the liver. But today the main topic of our video is chronic venous insufficiency. In this case, the problem is mainly in the lower part of the legs, where the outflow of venous blood is disrupted. This is called chronic venous insufficiency. This, in turn, leads to varicose veins, vascular asterisks, phlebitis, which is an inflammation of the walls of the veins, or even to the so-called deep vein thrombosis, in which blood clots form in the veins. These are some of the symptoms that do not manifest with insufficient blood flow to the venous system. The first, it's a syndrome of heavy legs. The second is swelling of the legs and ankles. Then there is pain in the legs and restless leg syndrome. Skin lesions are also possible. The skin may become shiny, the hair on the legs may fall out, itching may occur, and the skin color in the lower part of the legs may change. Many women experience varicose veins and problems with veins in the lower legs after pregnancy. This is due to estrogen. Thus, estrogen is another cause of venous problems. This phenomenon has not been sufficiently studied yet, but we know that veins have receptors for estrogen. Therefore, an excess of estrogens can affect the venous system, and this phenomenon is also observed in men. In women, during menopause, estrogen levels decrease, but progesterone decreases even more. At the same time, the ratio of estrogen to progesterone turns out to be high. Despite the fact that estrogen levels have dropped, progesterone drops much more. This can be considered the dominance of estrogen. In men, testosterone levels decrease with age. Because of this, their relative estrogen levels are also increasing, especially if the liver is damaged, because the liver is a key organ that regulates estrogen and mitigates its excess. So, with all this in mind, the best remedy for lower leg vein problems is red grape leaf extract. I learned about this from a patent. It describes a large study, and the patent is based on the results. If you are interested in reading more about the source of the information, all the links are in the description below the video. So, a clinical study was conducted on a fairly large number of people with venous insufficiency from a small to medium degree. The amount of red grape leaf extract given to patients ranged from 360 to 720 milligrams per day for 12 weeks, and the results were excellent. Red grape leaf also helps with enlarged liver, enlarged spleen, leg tumors and hemorrhoids, bruising, bleeding, nasal congestion, and enlarged capillaries. In addition, it perfectly relieves inflammation and also helps to balance the permeability of capillaries. Also, of course, I recommend regular walks. We need to move actively. No need to sit or stand for a long time. Friends, if this video was useful for you, then like it and share it with your friends. Write in the comments, have you heard about red grape leaf extract before? If you have already tried to be treated with this remedy, then share your results in the comments.